Freshly secreted wax is a light brown, almost an orange shade. And as it ages, as it matures, as it oxidizes, just like an apple or an avocado, when you cut into it, it turns into a darker colour. And so this has been there for a while. The patient also has a chronic history of suffering from swimmer's ear. So swimmer's ear is when you get otitis externa, which is an outer ear infection due to water getting inside the ear. And their ear was very, very tender upon attending, so we had to be really, really gentle. And this blockage extended all the way from the entrance of the ear, and you can just see there the suction probe just got blocked because this wet wax was clogging up the tube. So one of the questions I think I received in yesterday's video is, how do we unclog the tube, or is it possible to unclog it whilst the suction probe's in the ear? The answer to that is no. You have to remove the suction tube, and with each suction tube, so these are all single-use sterile instruments, there's a cleaning rod, and we just shove it through the tube to unblock it. And this extends all the way to the patient's eardrum. So the average length of an ear canal is about, on average, 2.6 centimetres. It varies for gender, so women have slightly shorter ear canals than males, and obviously adults have longer ear canals than children. Now, they have been symptomatic for almost a year, so they should have really had this removed far, far sooner, but intermittently they felt that it got better. So as is quite common, people tend to then leave it, and I'm guilty as charged sometimes. Sometimes you ignore your own health, you've got so much going on, and then you later regret it. You can see to the right there, there's some granulation tissue. So what's granulation tissue? When, not just ear, but when you have an infection or wound, and when your body begins to heal itself, you sometimes can get a collection of connective tissue forming as part of the healing process, and that area of connective tissue then has its own blood supply, it develops its own blood vessels, and it ends up, we call that granulation tissue. And you can see what it looks like. It looks like a pimple. It's quite red, it's quite wet. And so at this case, at this stage in the procedure, I want to just remove this without accidentally touching that granulation tissue, because it can be a bit sensitive. So it's a clear sign that the patient had some sort of trauma in the ear may be infected. So again, we're just being really, really cautious here. I'm just slowly but surely going towards the patient's eardrum, funneling through. It may also just be the case that this granulation tissue occurred because of the compression caused by this wax plug. The patient has been getting water in the ears, as I mentioned. They have chronic swimmer's ear, so we did give some advice to the patient. Patients also already got some custom swim molds, but sometimes they need to have new swim molds made, and that's because our ears, the cartilaginous portion anyway, continuously changes shape. As we get older, the cartilage can weaken, it can collapse. It could be that their custom swim mold is no longer providing an adequate seal. Some treatment for granulation tissue, if it doesn't just resolve by itself, ENT can cauterize it, so they almost burn it with silver nitrite, and it just burns all this granulation tissue, all this connective tissue, and it allows the ear to kind of re-heal again, and hopefully the second time without this buildup of connective tissue. Sometimes I know ENT can prescribe some acetic acid. In the UK, you can get that over the counter, and that's what the patient's going to do in the first instance. So this last plug of wax, it's really deep, it's impacted against the eardrum. Such was the impaction, I'm pretty sure the patient had been using cotton buds as well, because it was really, really impacted. You can see there's a lot of hair there as well, so hair shouldn't be this deep in the ear. The hair follicles are located in the outer third, so again, we kind of know this hair's been pushed in. So it's been trimmed at the entrance and it's been impacted in. You can just see the back part of the eardrum there. So at this stage, the patient's hearing had dramatically improved. The pressure feeling that they came in had relieved, but nonetheless, we still want to try and get as much of this wet, damp wax out of the ear. So you can see it again, it's just blocked the suction probe. Whilst you're watching that, I'm just going to go through some of the some questions now. It could be that in some videos I'm not going to be able to do this because there's a lot of questions being fired now. Some of them I've talked about them in previous videos, and so it may just be that you just have to go through some of the videos, but One of the questions are why are the ears sensitive to cold weather? So there's loads of nerves on the eardrum, and sometimes for cold weather. So a lot of people who cycle, for example, when there's high winds and it's cold winds, the wind can hit the eardrum, and if it's sensitive, these nerves get excited and it can cause a bit of discomfort. So a simple fix for that was to wear earmuffs. You can develop some people's surface ear. So surface ear is when you get bony spurs growing on the bony part of the ear canal, so the inner 2/3. And the process is called periosteal refrigeration. So when the bony part of the ear canal gets cold, blood vessels dilate, and that encourages growth of new bone spurs. You normally get 3 in the ear, one at 12 o'clock, one at 4, I believe, and one at 9. So they normally come in a 3, these bony spurs. So whilst I'm just explaining that, I'm just going to go back to the video very quickly. So the eardrum's clear, just some dead skin at the bottom of the ear canal, just trying to gently peel this away. I'm also going to mop up some debris around that granulation tissue. There was another question about whether I'm able to definitively diagnose whether it's psoriasis or something else going in the ear. So I'm not actually medically trained, I'm not a doctor, I'm not an ENT doctor, and I'm not a dermatologist, but I've just done a quick Google search, and eczema is when apparently your ear is really, really itchy. Psoriasis can also cause itchiness, but psoriasis is also when the patient can also feel kind of a burning almost sensation. So I can't give you any more, I can't elaborate any further than that, I'm afraid. That leads on to another question. Someone asked whether I'm a doctor. No, so in the UK, so if you're an audiologist in the US, I believe you do have the title of a doctor, but in the UK it's not. And that's why I'm very careful at the beginning of every intro is to refer myself as Mr. Now, Mr. in the UK can also be a bit confusing because if you're a surgeon in the UK, you don't hold the title doctor, you hold the title Mr. But a lot of the viewers I have are from the States, the majority are, and I think it's different there. So, and I quite often get referred to as a doctor, and hence why I always call myself Mr. because obviously you can also call yourself Mr. in the UK, not being a surgeon. And it's for the pure purpose, I don't want to mislead anyone. I've had criticisms unfairly labelled to me in the past where other people have referred to me as a doctor, and I've never said that I have. So that's why I always refer to myself as Mr. So there's no confusion, so I'm not a doctor. I think there's another question about blackheads and whether it can affect hearing. The answer is no. Blackheads do not affect the pathway of sound. It doesn't affect the middle ear. It doesn't affect the organ of hearing. So no, it's not a service I offer, removing blackheads, and can have no impact on your hearing. So that's that granulation tissue on the posterior canal wall. There's the patient's eardrum, fully visible. So this is the patient's right ear, and it's a lot drier, a lot more short, more crumbly, the texture, like a shortbread biscuit. I'm just going to remove this using a combination of an ear hook and suction. Another question was whether some sort of ear inserts, sleep plugs, for example, if your partner snores at night, can cause damage to your ears. Well, they can push wax further in if you're a waxy person. If they're not custom made, they can be a bit tight. They can cause a bit of humidity. So you just got to weigh up the pros and cons, I think. There was another question about what we call benign positional paroxysmal vertigo. In short, that's called BPPV. There's crystals in the ear that can find themselves in a part of the ear where they shouldn't be. These crystals are called otoliths, otocania. The exercise is called the Eppley maneuver for that. Some other questions about which other services I provide, or whether what hearing aids I do. So I work with all hearing aid manufacturers. Different manufacturers have different products which are suitable for different individuals and their individual hearing needs and practical needs. So I'm purely private in the UK. I don't, although patients get referred to me from GPs and other audiologists, but it is a private service. I don't use irrigation, and that's another